Hi, Dr. Raj here, and today we're going to talk about cardiology, one of my favorites for the board exams. Specifically, I like to talk about diagnostic cardiac imaging, focusing on CT coronary angiography with fractional flow assessment. Wow, that's a mouthful right there. So when do I think about using this diagnostic imaging in someone that comes into the emergency department and their workup for coronary artery disease is so far negative? What is going on? So anytime you see chest pain on the boards in the emergency department, best first initial diagnostic test is going to be ECG. And in this example, it's going to be negative because if it was positive ST elevation or depression, we'll be talking about acute coronary syndrome. We're going to check those troponins, whether it's troponin I or T, or my favorite eye sensitivity troponin. And in this case, they're going to be negative. If they're positive, we'll be talking about acute coronary syndrome. So now the patient asks you on the boards, hey, if the ECG is negative, the troponins are negative, how do I know for sure it's not my heart? Your job is to risk stratify them. What is their risk for coronary artery disease? Is it low? Is it moderate? Is it high? Then after that, you may choose something very traditional, like a cardiac stress test, make them run on the treadmill, or give them some chemicals and do a nuclear scan. Or an alternative is the CT Coronary Angiography. And this is not for everyone. It's going to be someone who's younger in age, they don't have calcifications on the coronaries, and you must be able to control that heart rate. When we do the imaging, we actually can give a medication like a beta blocker to help control the heart rate. And if we do a little fractional flow assessment, they could tell me about the blood flow to those coronaries. So this diagnostic imaging is a high-yield topic for your board exams.